not the only answer here. If we have someone in the community right now who's ill, our advice is to stay home. Right? So regardless of what virus they have, if they stay home, they're dramatically decreasing the chances of transmitting that virus. Testing is important, and we're expanding it, and we're going to continue to expand it, and we're going to continue to expand our criteria. But remember that the focus has to be on the entire approach we're putting in here, the social distancing as well. It's not just a focus on testing.
Steve from the Canadian Press, please.
Oh, hi, it's Steve Lambert from the Canadian Press. Dr. Lucen, you mentioned off the top that most of the 14 new cases are believed to be travel-related. I understand it's early, but are any of them believed to be community transmitted?
Right, so it depends on the definition of the community transmitted. So we have some of them that are been contacts of known cases. And so you could consider that community transmission because it's transmitted here. When we talk about community transmission, we're really referring to pop-up cases where we can't link the individual to a known transmission chain. So I don't have evidence of that at this point. But from the preliminary reports, these are either related directly to travel or to a known transmission chain. So that's where we're at right now. There'll be more to follow.
So if I understand correctly, and correct me if I'm wrong, if somebody travels and then comes back, doesn't socially isolate, and spreads it to one person, that one person is not considered a community transmission?
We would consider that a community transmission if we couldn't locate the transmission chain. You know, so we could just even a household transmission could be considered a community transmission. It's just when we have a very good idea of the transmission chain, it's less concerning than having somebody diagnosed, say, in the hospital that we can't link to any transmission chain or can't link to travel. Those are the real concerning ones that might indicate sustained community-based transmission.
Okay, if I can have a follow-up, it's are there concerns about the reagents, the new reagents? I understand there have been some issues with perhaps false negatives due to a low viral load. Are there concerns about the new reagents and whether that might affect one way or the other, any false negatives?
No, the standards practice at the lab are quite high, so we know that any test, no matter what it is, there is a range of risk of false negative or false positive tests. So that's not unique to this test, that's with any test. And so as they work on increasing capacity, they maintain strict standards. So there's always a risk of false negative or false positives with any test. I don't anticipate as they increase capacity that's going to negatively impact any of that.
From CBC Radio Canada, Patrick.
Yes, hi. Patrick Foucault, Radio Canada. We've had some people who are still a little bit confused on what do we mean when we say self-isolate when we come back from a trip. Some people are asking themselves, can I just go for a walk, even if I live in a rural area and I'm far from other people? Can you specifically say what we can and what we cannot do, basically, when we're in that situation?
Right, so this is something that's come up a number of times, and I've mentioned that it's really difficult to provide specific advice for the myriad of possible eventualities in every circumstance. So we give broad advice what self-isolation means, and self-isolation means, for the most part, stay home. Stay away from other people, limit the chances that you can transmit this virus to anyone else should you become ill. And so if someone lives in a house in a rural area with not many people around and they go out for a walk and keep their distance from everyone else, then yeah, it's very unlikely that would be putting yourself in a position to transmit that virus. Walking to and going shopping in a store, no, that's not what self-isolation is. Going down a 20-story apartment elevator is not self-isolation, though. So just simply saying, yeah, I'll go for a walk can be misinterpreted. So it's very difficult to provide a message here to the unlimited individual circumstances that could potentially arise.
I understand. Thank you. And for our French viewers, we have some French people who said they tried the French version of Health Links, Info Santé, and they said that when they ask to be served in French, they are waiting over an hour. We've had comments of people saying I've waited for an hour and a half while it's decreasing for the Anglophone version of it. The line, when we finally were able to talk to somebody, the line cut. We've heard these comments, so some people are wondering, do we really get the same level of service in French than we would in English? What can I think that question would be for Mrs. Ragusa. What do you have to answer to that?
Well, thank you for letting me know about that. We will make every effort. I'll follow up and see if there's some solutions so that we can better serve our Francophone population.
All right, thank you.
From Global Winnipeg, Brittany.
Good morning, Brittany Greenside here from Global News. Dr. Can you talk about people misrepresenting themselves to get tested? Are you saying they're lying, and what do you do to ensure people are telling the truth?
So this was, these scenarios that were brought to our attention weren't really about being tested for COVID-19. They were individuals presenting for care for various reasons, and the treatment provider later discovered that they were to be self-isolating, and so extra precautions weren't taken. And so what we're doing is just, again, getting that message out that this is important. People need to be aware of the importance of self-isolation, to be open to their treatment providers if they were required to be self-isolating, because it doesn't mean they're going to be denied care. Just means that people need to be prepared to take those extra precautions. So just again, the importance of being open about recent travel, to be taking the precautions that you're been advised to take if you've been recently traveling. So that was what the issue was I mentioned today.
What is the fallout here? Because we're getting messages from our viewers and listeners who say, you know, we're being too soft here with encouraging people to be honest, or encouraging them and recommending they stay home. At what point do we kind of put a fist down and start fining people?
Right. So there's, you know, again, this is really that time where we want Manitobans to start working together. Right? And so we know that there's always going to be a very minority amount of people who may not listen to advice, right? And so we're not asking them, right? So we can put orders on right now to any individual that we feel is putting the health of the public at risk. So we're not asking people really to self-isolate. They must self-isolate. Things of enforcement is sometimes challenging for this. We know that our federal partners are working on a plan as well to help with some of this. And so there'll be more to follow on that later. But right now it's not simply that we're asking people. We have the ability to ensure compliance with a number of these things. So, but the most importantly is we just want Manitobans to understand their role, that they can do their part, and that everyone's role here has an impact on other people, including people around them that they love. So that's the big message.
From CBC Winnipeg, Bartley.
The key to CBC here. In addition, Dr. Russin, to the person who's in critical condition, are you beginning to see people present themselves at ERs with respiratory symptoms in greater numbers?
We have not seen an indication of an increase in ER visits or an increase in ER visits for respiratory symptoms. That's some of the things that we're monitoring with our, as we say, syndromic surveillance. So that's another thing that we keep our eyes on.
Is one of the new presumptive cases a healthcare worker?
I don't have all the details on on every single case at this point. I'm not aware of any of these new cases being a healthcare worker.
Are any cases healthcare workers at all in Manitoba?
There is one that I'm aware of that was not working during their infectious period, though.
Is it that doctor, one of the doctors that was at the Alberta Bonspiel?
I'm not going to release any specific information on anyone.
Thank you.
From CJOB, Clay.
Hi there. Dr. Russin, this may be a city matter, but we have just been sent a photograph of the Main Street project, the homeless shelter there, and there are people literally right next to each other on the floor. Obviously, there's no social distancing happening here at all. I mean, they're right next to each other. Any comment on that?
So we've been working with a number of the shelters and places that provide these social supports, and so we're continuing to look at that. And these are, challenging things because we need to be able to provide support for individuals. There is some limitation of space, but we're working on that and going to try to keep all of Manitobans safe.
I would also just echo those comments. So we do have a plan in place, continuing to evolve, but for vulnerable populations and potentially homeless populations. So if I haven't seen the pictures for Main Street project, but they should be looking at ways to socially distance when possible. And if we can, we are looking at where we could locate people in safe places during this COVID pandemic. So more information is to come on that, but we really would encourage, it's always challenging in different physical environments, but as much as possible to look for those solutions.
Is it still all right for people to go visit their hair salon or a man to go still see his barber? Some are closed, but some are still open. Will those hair salons and barber shops remain open?
So as we see the increasing community-based transmission in other jurisdictions, and as we see our numbers rise, we are going to be taking further steps. I think that our social distancing messages have been out there for some time, that now is a time to be staying home when you can. Non-essential reasons for leaving your house, this is not really that time. This is not that time for just the business as usual. So moving forward, we're going to provide more directions that address that question. But I think we've been providing some clear advice in that regard up to now anyways.
From the Winnipeg Free Press, Larry.
Larry Cush, Winnipeg Free Press. Dr. Wilson, I'm wondering if you could comment on the age of some of these cases. I see, while I see a few people in their 60s, there's a lot of younger people there. So are we seeing in part an impact from returning on snowbirds? But obviously, there's a lot of people from different age groups, even girl under 10. Could you comment on the ages of the young cases?
Right. So we know that the COVID-19, that there isn't a particular age group that's certainly immune to being infected with this. We know that children tend to be underrepresented in the total case counts and tend to have milder illness. From the data that we have, but as we typically see, we're seeing a wide range of ages. We know that those over age 60, over age 65, with underlying medical conditions or immune compromise are most at risk for the severe complications of COVID-19. But the the variability, the age range that we see is to be expected.
I have a follow-up on testing, and I'm wondering, until today, we had a very limited number of positive tests, and we had no